Hello and welcome to Health Digest, the program that brings to you news, analysis, and conversations on everything that concerns your well-being. I am Ogom Ezedimbo. Today, we turn our attention to fertility, an issue that affects millions of couples across Africa, yet remains heavily stigmatized and often misunderstood. At the MEG Foundation African Asia Luminary in Banjul, the Gambia, I sat down with the fertility experts, Dr. Denise, who shed light on the causes, prevention and lifestyle choices that can improve fertility outcomes for both men and women. According to her, infertility can be linked to several factors, including hormonal disorders, infections, untreated sexually transmitted diseases, advanced maternal age, obesity, excessive alcohol intake, and low sperm quality in men. So we're talking about fertility today. We see so much stigma around fertility, especially, and most times when the stigma comes, it comes from people around, people who are very close to you. But before we go into that, let's quickly know what fertility is about. At what point would you say a woman is infertile or a man is infertile?
Okay, so the definition varies. So for the definition, the most important factor is age. I mean, in terms of diagnosing now. So the definition, according to the textbooks of infertility, is 1 year of unprotected sex, on time, unprotected, having sex regular, no protection, no family planning use for 1 year. Okay. After that, if no conception, then we say there's a fertility issue. Either partner, whether the guy or the lady, must have some issue concerning fertility. The second definition is that's why I say age. It's 6 months if you are above the age of 35. So when you are 35, especially for the female, between 35 37, and you have 6 months of uninterrupted, sexual intercourse unprotected, and yet and still conception has failed, then you need to come to see the gynecologist or the fertility specialist. So below 35 is 1 year, above 35 is 6 months.
So what could be the cause of infertility? Because I don't imagine how people have sex for 6 months and then nothing is happening.
Well, you see, the cause of infertility is multifactorial. There are a lot of things that interplay when it comes to, as doctors and fertility specialists. It's always good to delineate. The first thing is infertility in a female that have never gotten pregnant before. The causes there is different. Most often it's hormonal. Then we talk about infertility in a female that have gotten pregnant before. It doesn't matter how the pregnancy was terminated, whether the pregnancy was terminated through live birth, whether it was terminated induced in through abortion, expel. It really doesn't matter. For us, the most important thing is the person got pregnant. So in that situation, the cause or causes might be different. Might be due to, especially for people who terminate through abortion and people who have multiple sexual partners before, infection plays a big role. So now we are looking at, are the tubes open? That is one of the most. In fact, when I was at Indra, thanks to the Merck Foundation in India, the Merck Foundation did a very good study that I still use to this date. They discovered that about 80% of women in sub-Saharan Africa, that is where, Liberia and other countries, are located that have gotten pregnant before, but now they are having problem getting pregnant again. 80% of them have tubal problem. That is, the tubes are blocked.
Okay.
And that is due to infection, untreated infection. So you see, we're having a big problem in Africa, sub-Saharan Africa, with infection. It's because we either poorly treat the infection, we under treat the infection, or we don't even treat the infection at all. So that, those are just the big reasons. And let me just say, closing on this, one of the things that, based on my experiences treating infertile couple, that is coming up is the issue of stress. People don't pay attention to that. Stress. Yeah. A lot of young people, like you said, the stigma, people don't know. They become stigmatized by people very close to them, like you said, husbands, mother-in-laws, sister-in-laws, brother-in-laws, the close family members. That leads to immense stress, and it also leads to infertility. I have had 4 or 5 instances. These are people that, most especially of Arab descent, who had no issue, and they were less than 25, but could not get pregnant. We try every other thing. Tubes are open, this open, nothing. Male, okay. And all I needed to do was just counsel. I tell you, 100% of them got pregnant in less than 1 year. Just basic counseling. Just basic counseling. So it points to the fact that a lot of these people, they just need counseling. And every day, send WhatsApp messages to them. Oh, it's okay, you can get pregnant. Don't worry, you will get pregnant. And it was like this back and forth. Most often they need people to talk to, but because a lot of people don't have the time to even listen to them and their fears, so they just continue to grieve inside. And then what I do usually is, whenever you have issue, just call me. If you have any question, just call me. And sometimes the most difficult part for this subset of women is just receiving their menstruation. Once it starts to come, they go into tantrums. They are like, why God, why me? If menstruation for them is like the devil. Every month they anticipate not seeing it. And sometimes they do. Sometimes they do not see it because of the stress. And then they will call, oh, I didn't see my menstruation, but the pregnancy test is negative. I say, it's your mind. Just relax. So I'm just saying this to say that, stress is something that is has started having a negative impact, and it's because of the stigma that we have associated with being infertile. Okay, so it's something we need to break that stigma.
So how do we break that stigma? What practical solutions should we put in place to break that stigma?
So one way is awareness. Is this, creating awareness is the most important way or intervention for us to break the stigma. Because the more information we give to the public about infertility, that infertility is not a disease, it's not something that cannot be cured, it's something that has a lot of interventions, okay, that you need to seek care at the right time and at the right place. I think with the information, a lot of people will accept, this as a journey, and then they will seek care based on what we are telling them. Because most time, women suffer in silence. They don't know who to turn to. They don't know where to go, and that is one of the reasons why infertility has become so much linked to mental health because of the silence. So we need to first create awareness, and this is what we're doing. And thanks to the Merck Foundation for even training, doctors like us, to be able to not only diagnose infertility, but to actually offer pathways through which people can have access to infertility care and realize their potential that indeed they are capable of conception. So I think awareness is just, and you don't need to be a doctor. You just need to have a passion, and you need to know how to tell a story.
Let's come to treatment. What kind of treatments are available for infertility?
Okay, so there are lots of treatments, especially in the age of IVF, that is in vitro fertilization. For me, I say the options are just countless, and the extreme is surrogacy, where once you can carry, you can have someone carry your baby for you. I mean, they can take your egg, take the husband's sperm, and unite it in a test tube like every other IVF procedure, and then they transplant it into the uterus of another woman who have actually been prepared, and then that person can get genetically the baby belongs to you.
That's still like the IVF treatment process.
It's part of, yeah, it's part of the assisted reproductive, it's all part of the assisted, IVF is one component of the assisted reproductive, chain of treatment for infertility. So you have the IVF, you have the ICSIS, that's the intracytoplasmic, sperm injection. You have lots and lots. You have surrogacy. Those are all assisted, reproductive technology uh, when it comes to helping a woman to conceive. So first, let's start with the basic, because in some countries we do not have access to IVF. Okay, so for us, IVF is like a terminal stage to treatment. That is, if we have exhausted all other options, then IVF will be the last resort. So the basic, first of all, you need to know the source of infertility. That is the most important issue. Because if you do not know the source of infertility, why you are infertile, it will be difficult to, actually identify the type of treatment. So if you have issue with infertility, you visit the gynecologist, or most people start with the general practitioner. And if you come to the specialist, we can do serial tests, both male and female. Now, let me just offer a disclaimer, because this is very important. We have started seeing lots and lots of cases of male associated infertility. I don't know why, but just recently, most of the semen analysis were just zero sperm, sperm less than 1 million. So, I mean, it's just bad. So we need to start also in our awareness, raising the issue of male associated infertility is becoming a problem. Maybe, and I can say most likely it's the lifestyle. Okay. So once you get a test done, for the man, it's simple, it's a semen analysis. For the woman, you can do ultrasound, you do HSG to look at the tubes and everything. If you identify the issue is with the men, again, you start to investigate. For us, if he has low sperm, you look at the hormones, the hormonal level, what is happening. If it's obstruction, you need to release. If it's varicose veins, if he's abusing alcohol or whatever, you need to just target your intervention based on that. Okay. And then also for the females. Now, what I want for us to know and appreciate is, if you want to have natural conception, that is, you want you and your partner to get together, and then you as a female give birth or procreate or whatever, you must have a patent tube. The tube is, you see, for female, we have the ovaries here that store the eggs to maturity. We are born with all our eggs for females. And then what connects the ovaries, where the eggs are, to the uterus, where the baby is supposed to grow, is the tube. So now the egg will leave every month. You ovulate, that is, you expel one egg, it's captured, it travels through the tube. Now, it is only within the tube that natural conception occurs.
Okay.
So once the tubes are blocked, you either flush the tubes, and if it open, because some people have, there is a new thing coming up called the oil contrast medium and the water contrast medium that we use sometimes to flush the tubes. In some cases, there have been some successes according to what science is showing now. So if you have blockage, maybe you can try that. If not, the only other way to conceive is through IVF. So once the tubes are blocked, you cannot conceive naturally. You have to undergo assisted reproduction, assisted reproductive techniques. Okay, so in that way now they will stimulate you, remove your egg, retrieve the sperm from the male, unite it in a test tube, and after somewhere they say 3 to 5 days. Indra now is 5 days, because remember now, once the egg and the sperm meets in a test tube, it takes between 6 to 7 days for implantation to occur. So during that time, there are a lot of division going on. So that is the same thing they want to mimic, so that they don't implant the zygote in the uterus when it's still immature. Spontaneous abortion may occur. So then they keep it for around that time and implant it in the uterus just to mimic the natural cycle. So then you'll be able to conceive. So that is it. So once the tubes are blocked, then you need to look for other ways. That is, you cannot conceive naturally, except you want to try maybe flushing the tubes, and that is 50-50. But otherwise, I would just advise, just go do IVF. So that is the treatment. For the men, you can boost the hormonal level. You can, there is also a technique that you can use to extract the sperm, because some, I've seen 1 or 2 cases where we needed, not in Liberia, but in other countries, we had to refer them. They extract the sperm from the testicles, the testes, because the guy could not, he has severe obstruction produce, but he can't expel. So now they get extracted under the microscope, and then take it and also treat it and unite it with the egg. So those are all different treatments. But again, it's just, you need to know what is happening. But for me and for us in Liberia, once the tubes are open, really, it doesn't really matter. We usually don't refer you to IVF. We manipulate, because we got IUI, we got other things that we can do, and to help the patient to conceive, naturally. So those are just some of the few options that are out there.
Obviously, technology is taking the lead in ensuring that women who needs the children carry their children. But let's look at the government angle. We see what Merck Foundation is doing. This is an individual foundation. Don't you think if we take this more like government takes over, it's going to be better?
Yeah, but I think the reason why Merck Foundation is doing this is because of the partnership they have with the government. So the way I see it, the Merck Foundation is building the human capacity, and the government is making space for employment and utilization of the capacity that Merck Foundation, have built over time through training. So that partnership is I think that is the reason why Merck Foundation have lasted this long and continue to expand. Because once they train back home, government absorb them, give them the space, to do what they have learned through Merck Foundation, and then we see the outcome. But however, uh, I think, like you said, government needs to go further beyond just absorption training. Let me say employment. They need to now create some space in terms of continuous education. How some of these training programs can be, established back home, so that those people who have the experience and who have been through some of these trainings can actually pass on, the knowledge to those who are, back in the country, and also like invest in health, like what some people have been exposed to through the training. When they get back home, at least some of those facilities be, produced there, so that they'll be able to work, within that environment, and stuff like that. But I think the mentorship is very critical for now. That is the low hanging fruit that government can do. They can invest in mentorship, and then training for those who, are yet to benefit from Merck Foundation. Because come to think of it, Merck Foundation will not train all of the doctors there. So the ones that they are investing in, is good that we have a cohort that, they can be trained. They can also train their fellows doctors back home.
But in all of this, is there a place for nutrition? Does it play a very big role in
Yeah,
improving fertility care?
yeah. Nutrition is very important, and when I was coming from my hotel, I saw here a big building called Department of Nutrition. In It's a standalone building. I was so impressed that in the Gambia they have prioritized nutrition to the point where, they have a standalone, like, full-story building just dedicated to nutrition. Nutrition is very important. That is one of the things that my minister, Dr. Louise Koto, she has started advocating for. And once upon a time, in meeting with the pediatricians in Liberia, when she called them to, discuss the way forward, one of the issues they pointed is nutrition. And not only for fertility, for even people dying and succumbing to disease quickly, is because of nutrition. Once you have a poor nutritional reserve, even malaria that usually doesn't kill will kill you, let alone chronic diseases. So for us, fertility specialists, one of the things we do most often is to give supplements. Supplements is like nutrition, because it's something that you fail to eat through your diet, maybe because you are eating too much fatty food, not something healthy. So your body is deprived from those nutrients. So we give supplements. So and then again, the sperm and the egg, for them to actually grow and become attractive to each other, they will need zinc and certain trace elements that you can find in plants and vegetables. So it boils down to nutrition. So one thing is, I will encourage people, and thank you for bringing it up, when we are raising awareness for infertility, it's also important to chip in nutrition. Because with all, not nutrition is not really just eating, it's the benefit that we get from the food. And that's why they say nutrients. Okay, the nutrition is, from the word nutrients, what you gain, the benefit you gain from the food. One time my husband and I, he was playing something, and somebody was calling. They say T asset. When they say asset, it means asset to you. They say hamburger, they say liability. It means that
That's harmful.
yeah, it's harmful. You will get a full stomach, but it will be a liability to you. So you see, so that's how I was like, oh, I think I need to use it for my radio show or to just educate people and stuff like that. We need to classify our food and what we eat into asset and liabilities. Some of the food actually is complete liability. Instead of even adding value to your body and making you grow and regenerate, in terms of your fertility, it will, in fact, do the opposite or the reverse. It will take away, because once it produces free radicals, those free radicals savage, your eggs and other things, and that is a problem. So nutrition is very big and something often overlooked, but it has some detrimental effect.
Infertility is not a life sentence. It is not a woman's burden alone. With early diagnosis, healthy lifestyle choices, stress control, and access to expert care, many couples can achieve their dream of starting a family. And that's it on this edition of Health Digest. Thank you for watching. I'm Ogom Ezedimbo. Stay safe, stay healthy, and join us again next time. Bye for now.